Look at your feet right now. Don't scroll, don't delay, just look. Because what I'm about to tell you, most people realize too late. Millions of people are walking around right now with early diabetes, and they have no idea. No pain, no diagnosis, no warning from their doctor. But their body is warning them, and in many cases, it starts right there, in the feet. The problem is, nobody tells you to look. After years of observing patients, I can tell you this clearly. Your feet often show the first signs long before anything appears in a blood test, and most people ignore them. Welcome. If you want simple, clear explanations about your health that actually make sense, subscribe now. This is the kind of information most people only hear when it's already serious. Now let me show you something. Imagine this. It's early morning. You wake up. The room is quiet. You swing your legs off the bed and your feet touch the floor. And something feels different. Pause. Not pain, not sharp, just off. A slight tingling. A strange numbness. Maybe your feet feel colder than they should. You pause for a second, then you ignore it. Because life is busy. You get up, you move on, you forget. Days pass, weeks pass. Then one day, you notice something else. A small crack on your heel. It doesn't heal. A cut takes longer than usual. Your skin feels dry no matter what you do. Still, you ignore it. Most people do. But here's the truth. This is not random. This is not just age. And this is not something harmless. Your feet are not the problem. They are the signal. Most people think diabetes starts suddenly. They think one day you get it. But that's not how it works. It builds. Slowly, quietly, over years. And during that time, your body sends warnings. Small ones. Easy to ignore. Until they're not. This is not what you think. It's not just about sugar. It's not just about food. And it's definitely not just about weight. It's about damage that starts long before diagnosis. Let me explain this in the simplest way possible. Think of your body like a city. Your heart is the central pump. Your blood vessels are roads, and your nerves are electrical wires. Now imagine what happens when sugar levels stay slightly high for a long time. Not enough to feel, but enough to cause damage. The smallest roads begin to break first. The narrow streets, the distant areas. That's your feet. At the same time, your electrical system, your nerves, begins to weaken. Signals don't travel properly anymore. And this is where it gets serious, because once that damage starts, it doesn't stop on its own. But here's what most people don't know. Your body gives you a window, a chance to notice, a chance to act. And it starts with these signs. Let's go through them carefully. The first sign is tingling or burning. You might feel it at night, or when you're sitting still. It's subtle at first, almost like your foot fell asleep. But this is your nerves reacting. They are under stress, and most people ignore this stage completely. The second sign is numbness. This one is more dangerous, because when you lose sensation, you lose awareness. You can step on something sharp and not feel it. You can develop an injury and not notice. This is where small problems begin to grow. The third sign is cold feet. Even when the weather is warm, even when your body feels fine, your feet feel cold. This is not just temperature, this is circulation. Your blood is not reaching the area efficiently anymore. The fourth sign is slow healing. A small cut should heal quickly, but now it stays. Days turn into weeks. This means your body is struggling to repair tissue, and that's a major warning. The fifth sign is skin changes. Dryness, cracks, darkening around the ankles. This is your skin under stress, and your skin reflects what's happening internally. The sixth sign is repeated infections, fungal infections, irritation, recurring problems. Your immune system is weaker in that area, and bacteria take advantage of that. And the seventh sign, pain at night. You lie down, you try to rest, and your feet begin to ache, burn, throb. This is often when nerve damage becomes more noticeable. Now pause for a second.
If you've noticed even one or two of these, don't panic, but don't ignore them either. Because here's the truth. These signs don't mean it's too late. They mean your body is asking for help. And if you respond early, you can protect yourself. Let me tell you about something I've seen many times. A patient walks in, late 40s, early 50s, no diagnosis yet, but they complain about their feet. Tingling, numbness, cold sensation. They think it's circulation, maybe vitamins, maybe just age. We run tests, and what we find is not severe diabetes, but early imbalance, right at the stage where change is still possible. That's the window most people miss, because they wait. They wait for something serious. But serious doesn't start suddenly. It builds quietly. Now here's what you can do, and keep this simple. First, check your feet daily. Not casually, intentionally. Look for changes, feel for differences. Second, move your body. Walking is powerful. It improves circulation more than most people realize. Even 10-15 minutes a day matters. Third, stay hydrated. Your blood needs proper fluid levels to flow efficiently. Fourth, avoid pressure. Tight shoes restrict circulation and stress your nerves. Choose comfort over style. Fifth, basic care. Keep your feet clean, dry, protected. Small habits prevent big problems. And here's something most people overlook. Consistency matters more than intensity. You don't need extreme changes. You need daily awareness. Now let me calm one fear. If you're seeing these signs, it does not mean something irreversible has already happened. The body is not fragile. It's responsive. It adapts. It repairs. But only if you listen early. Most people don't. You just did. And that already puts you ahead. If this made you think differently about your body, subscribe and stay with me. And share this with someone who might ignore these signs. Because sometimes, the smallest signals carry the biggest warnings.